Okay, so good afternoon, everyone. So as Keisha mentioned earlier, every first week of September, we celebrate Epilepsy Awareness Week. So medyo na-delay tayo konti just because last week we held our Congress in Tagaytay. So the Philippine League Against Epilepsy had our first face-to-face Congress since the pandemic. And actually some of the doctors in the neurology, OPS, and even our technician attended that event. So we will be celebrating it a little bit late here in NCMH. Nevertheless, we will still be discussing some modules that the PLAE created in line with this year's theme. Okay, so the theme for this year is epilepsy in the workplace. And I guess we're very lucky because NCMH is a medical institution. So a lot of the personnel here technically know how to manage seizures or know seizure first aid. But because we do see a lot of epilepsy patients, not just in the wards or in the pavilions, but also in the OPS, where we also have non-medical personnel present, I think it's very important that everyone here, be it our nurses, be it our watchers, be it the security guards, or even the admin staff, know what to do when somebody presents with a seizure. So we want to increase seizure awareness because we want to make NCMH a safe place for our patients with epilepsy. To start off, we want to define a few terms. So we want to define what seizure is. So by definition, it is a sudden, uncontrolled electrical disturbance in the brain. So in Tagalog, yung mga laging ginagamit na mga terms ng mga patients natin or even yung mga watchers nila is kumbonsyon, pagkisay, or pangingisay. But I'm sure that there are still other terms that they use, especially dun sa mga vernacular language ng mga iba't ibang mga lugar sa Philippines. So technically, it's an interruption in the normal connections in the nerve cells and can cause a seizure. So yung mga dahilan doon. Wait lang ah. Okay. Okay. So it is a temporary change in either any of these three. So movements, feelings, and as we all know, consciousness. Ibig sabihin yung paggalaw, kung ano yung nararamdaman ng pasyente, or yung pagkagising nila. So there are certain myths attached to patients with epilepsy. Hindi ako nakashare. Okay na. Okay, so there are certain myths that are very common, especially in the Philippines, di ba? So lagi nilang sinasabi, parusa, galing sa Diyos, di ba? Or iba naman, kulam, o kaya exorcism. So these are all myths. Epilepsy is a condition, it's a disease that people need to take seriously. Bakit hindi siya nag-move? Okay. So anybody with a brain can have epilepsy. However, it is not contagious, meaning hindi siya nakakahawa. So there's always this misconception na pag merong seizure ang isang tao, huwag tayong lumapit sa kanya kasi baka mahawa. When in fact, hindi siya parang pulmonya or hindi siya yung parang pneumonia or leprosy na kaya chickenpox na pag madikit ka, pwede kang magkaroon ng ganon. Because ang problema natin is innate. Ibig sabihin, nandun sa utak. At yung utak naman ng isang tao, di ba, protected naman siya by your brain. So, hindi naman tayo nagdidikit-dikit ng utak. So, hindi naman siya pag nagsalita ka, pwede mong matransmit yung seizure sa ibang tao. Okay, so by definition, ang epilepsy naman is 2 or more unprovoked seizures. So, ibig sabihin, hindi siya dahil meron akong lagnat, hindi siya dahil marami kang ininom na mga alcohol or gumamit ka ng pinagbabawal na gamot, hindi dahil nagkaroon ka ng bagok sa ulo or head trauma, or hindi dahil nagkaroon ka ng meningitis. So pag sinabing unprovoked, nangyari lang talaga siya. So at this point, there are 2 terms that you need to remember. epilepsy is the diagnosis, di ba? And then seizure is the symptom. So para po dun sa mga nagtatrabaho sa mga wards na nagpapadala ng request sa amin sa OPS, minsan yung nilalagay nila na diagnosis, seizure disorder. Ibig sabihin, gusto nilang malaman kung anong disorder meron yung pasyente. Pwede rin namang ilagay yung epilepsy, pero huwag kayong maglalagay ng seizure kasi ang seizure ay sintomas lang. Okay? So, napakaraming causes ng epilepsy. Pwede siyang genetics, pwedeng pinanganak lang siya na may ganoon or merong congenital problem dun sa brain niya. For the elder population, ibig sabihin yung mga matatanda, it might be secondary to a vascular event or a stroke. All ages, any form of head trauma, nabangga, nadulas, nabagok yung ulo. It can also be secondary to an infection in the brain like meningitis, or it can be tumoral. These are the more common ones. But technically, if you look at this slide, napakadaming pwedeng maging causes up to the genetic levels. So there are two types of seizures, two main types. I think this was mentioned in the video that Keisha flashed earlier before this webinar started. So you have your focal seizures. Ibig sabihin, focal isang parte lang. And you also have your generalized seizures. So mas madaling i-distinguish ang focal seizures from your generalized seizures because it means that only one part of the body has an effect or has twitching. So in the generalized type of seizures, there are also different subtypes and susubukan natin siyang daanan dahan-dahan. So for your generalized tonic-clonic seizures, by definition, ibig sabihin meron siyang dalawang phase. Yung nagpapalit-palit siya ng muscular activity. You have the tonic phase and you have the clonic phase. And then you also have your absent seizure. Ibig sabihin yung tumutunganga lang siya, bigla mo siyang kausap, tapos bigla siyang mag-freeze in the middle of the conversation. Na kahit anong gawin mo, kahit pumalakpak ka sa harapan niya or kahit gisingin mo siya, hindi siya bumabalik dun sa kanyang regular self. You also have your atonic seizures or your drop attacks. Ibig sabihin, naglalakad, kausap mo, and then in the middle of it, bigla na lang siyang magsa-slump down or babagsak. And then what you find here on the right lower part is your focal seizure. So usually, ang common na focal seizures is one side of the face, either the left or the right, tapos merong uncontrolled twitching. You can also have your myoclonic seizures wherein these patients present with generalized jerking of the body. So epilepsy is not a lifelong sickness. So the goal is seizure freedom. Ibig sabihin, walang seizure attacks for more than 10 years or a patient with no anti-seizure medication for more than 5 years. So we have this stigma that if you have epilepsy, it's forever. Parang hypertension, di ba? Kapag hypertensive, kapag high blood ka or diabetic ka, meron kang maintenance meds na magpapababa ng blood pressure mo or magpapababa ng blood sugar mo. So for epilepsy, it doesn't necessarily mean that if you're on a anti-seizure medication, you will drink it forever. And that is because there are patients whom the epilepsy through the years gets controlled. So it's just a matter of a continuous partnership between the patient, the family member, and the doctor. It's a matter of making sure that they are very compliant with their maintenance medications in the beginning. So lagi naming sinasabi para sa mga newly diagnosed epileptics na tiyagaan lang yung pag-inom and yung pag-timpla ng gamot sa simula kasi kailangan nating makuha yung perfect mix or yung perfect dose which would control the seizures. And then once these are controlled, after a few years, we start tapering them. Okay? So it also includes reminding the patients that hindi lang lahat gamot. Kasi minsan kahit na inom ng gamot, pero ginagawa pa rin nila yung mga bawal, like laging nagpupuyat o kaya nalilipasan ng gutom, stress, minsan extreme emotion can also add to seizure attack. So, lagi naming sinasabi, kahit pa po gawin nating popcorn, ibig sabihin, confident kasi, di ba, that there's a medicine that will control the seizures. If we do that, yet we still do not avoid the triggers, so we call that seizure triggers, yung mga mention ko kanina, then there is still a risk for these patients to have recurrent attacks. So it's a matter of pharmacologic, ibig sabihin gamot, and non-pharmacologic management. Ibig sabihin, yung mga dapat iwasan. Okay, so one thing that you have to remember is that epilepsy is curable. So here in NCMH, we do have certain medications that are available to control the seizures. But this has a lot of difference in terms of the side effects lang naman. So the older anti-seizure medications, which would include your carbamazepine, your phenytoin, your phenobarbital, acts almost as the same efficacy. Ibig sabihin, parehas sila ng control ng seizures as your newer anti-seizure medications like your levetiracetam, your lamotrigine, your topiramate, your lacosamide, and your perampanel. So the only difference, well, one of the minor differences between the two groups is that we see less side effects when it comes to your newer anti-seizure medications. Kasi 'di ba, pag old anti-seizure medication, I'm sure para sa mga medyo matagal nang nakakahawak ng mga pasyente, lalo na sa ER or sa pavilion ng seizures or epilepsy, ang phenobarbital at saka ang phenytoin, they have certain things that can be deadly to our patients. So it's a respiratory depressant. So kaya most of the time na-intubate ang pasyente kasi pag nag-load ng phenobarbital, yung breathing ng patient is also bumabagal. Pag phenytoin naman, it's not good for those patients who have heart problems because they're at risk to exacerbate these conditions, and they can also have phenytoin hand. And then, pag carbamazepine naman, so this subgroup of patients, especially yung nagde-develop ng allergy. So minsan, di ba, allergy, pantal-pantal lang. But there's this thing called Stevens-Johnson's disease na severe allergic reaction talaga sila, and it can also be devastating for the patient. So basically, this is the only distinction between your old anti-seizure medications and your new ones. But it doesn't mean that your new ones don't have any side effects. Lahat naman ng gamot, old or new man yan, neuro man yan, or cardio drugs man yan. So all medicines, they have side effects. So for the new anti-seizure medications, the more common side effect would include GI problems or GI upsets like your nauseated, kaya minsan they vomit, and then a more common one would include drowsiness, parang antok sila. So when they take these medications, that's why for certain anti-seizure medicines like your perampanel, we usually advise that they take it at bedtime para at least hindi sila lutang throughout the day. Okay, so what do we consider when we see a patient na following up at the outpatient clinics, which will have an effect in terms of how we manage the patient? Okay, so the first thing that we check is your seizure frequency, meaning gaano kadalas tayong magkonvulsyon. So if you have one seizure, definitely there is less risk for permanent damage to the intellectual or behavioral functions. Now, if you have frequent seizures, syempre, imagine niyo, sunod-sunod yung convulsion, sunod-sunod na nakuryente yung brain natin. So this may have an effect on the memory and intelligence depending on the seizure type. That's why when you see a patient in front of you seizing, di ba minsan pag natapos yung atake, para silang tulala. Parang hindi nila alam kung ano nangyari, titingin sila sa inyo. So the first thing that we ask is, alam mo ba kung ano yung nangyari sa'yo? Or alam mo ba kung nasaan ka? Kilala mo ba ako? So this is because when you have an attack, because nagkaroon ng abnormal circuitry dun sa brain mo, meron ding effect sa cognition at saka sa memory. Ibig sabihin, cognition, pagkaintindi or intelligence. Okay. So, what are the more common anti-seizure medication side effects? So, either you can be hyperactive, irritable, you may have a short attention span, which will translate into memory impairment. Sometimes naman, hirap kang matulog or lagi kang inaantok. So, this would fall under the category of your sleep alterations. And then for other patients, they would present with psychiatric problems, or they might become too aggressive, They may exhibit mood changes. 1 minute they're okay, and then the next minute para naman silang robot, para silang too down or frozen. So these are the things that we usually ask our patients when they follow up at the outpatient clinic, because this will help us in terms of tapering. So do we need to increase the meds? Do we need to decrease the medications? Do we need to add one medication to counteract the new side effect? So when a patient follow-ups with you at the clinic, it's not just the frequency that you ask for. You also ask for other things. So other things would include seizure medication side effects. This would also include asking the relatives, o kamusta ba yung pasyente sa bahay? Lagi ba siyang nagkukulong? Masungit ba siya sa'yo? Hindi lang yung observation na antok-antok lang ba siya or meron ba siyang parang physical na side effects. So, what we want to stress is that PWEs, or persons with epilepsy, can work, but with restrictions, and they would need clearance. So this is actually in theme with this year's theme of the PLAE, meaning epilepsy in the workplace, diba? So these epilepsy patients, be it a patient or somebody in your workplace, they have rights, diba? So they have a right to a safe environment. So if you are a diagnosed epileptic, they need to inform somebody. So di ba may health screening yan? They need to inform their HR. They need to have an emergency action plan. And then ideally, they should have seizure monitoring devices. And then they have to make sure that there is a backup plan, or there's a first aid kit somewhere in the immediate vicinity to ensure that a seizure will not prolong into a longer one. So be it the home, the school, or the workplace, we have to ensure that it is safe for anybody, and not just anybody with epilepsy. So they have to be careful, they have to be aware, and they have to be safe. So I mentioned earlier the different seizure triggers. So the most common one is compliance, meaning nakakalimutan nilang uminom ng gamot nila. So minsan nga kahit once or twice a day pa lang, syempre lalo na kung nag-aaral yung isang patient or he's busy with work, diba? Sometimes they tend to forget. Sometimes they tend to forget to eat also, which is another common cause of your breakthrough seizures. And then others would include lack of sleep, extreme exhaustion, and alcohol intake or narcotic use. As a word of caution for alcohol intake and narcotic use, we also try to remind our seizure patients to refrain from using this just because magdo-double yung effect niya. Diba? So ang alcohol at ang drugs, it can also make you drowsy. And when you take the anti-seizure medication, it can have an additive effect. So parang in a way, may some form of overdose symptoms ka rin kapag pinagsabay mo sila. So what to do? What do you advise your patients? Because you're the first line here in NCMH. So you have to make sure that they drink their anti-seizure medications and they drink it on time. So it would help if they would have those pill boxes, or if bata pa sila, usually diba, it's the parents or the caregivers who instruct them on when to take their medications. Sometimes they forget to take it on time. So it's okay as long as they remember to take it. But hopefully in the succeeding days, they remember to take it at a specific time every day, because it's important to establish a significant routine in these patients. When you establish a routine, then it gets to a point na para na lang siyang normal part ng buhay mo, na hindi mo naiisipin, ay, nakainom na ba ako? It's because it's part of your routine already. Number 2 is to sleep early. So for adults, the recommended duration, is about 7 hours or more. But we all know that when an adult ages, the amount of sleep required by the body actually diminishes. So parang inversely proportion sila. Pag tumatanda tayo, di ba, mas mahirap ng kumuha ng tulog. That's why for our patients who are like 80 or 70 plus, sometimes 4 to 5 hours of sleep is good for them already. Although, we would still encourage these patients, regardless of the age, to have adequate rest and sleep. For kids, we would want them to sleep at 8 to 10 hour lengths. Sometimes they would also have naps in the middle of the day, and that is okay. Number 3 is always eat on time and eat nutritious food, because sometimes your decreased blood sugar can also cause seizures. So what to avoid? I mentioned earlier, alcohol, because it can also mimic another seizure. So it can cause withdrawal seizures, especially 6 to 72 hours after drinking. And of course, illegal drugs. So as a word of caution, especially during the pandemic, di ba? Where a lot of kids had to go to school online and a lot of adults had to make do with work from home setup. We would want to remind our epileptic patients to try to limit also their exposure to screen time or excessive lights. If you would remember, especially early on pre-pandemic, for action movies, for those who used to watch action movies in the movie theater, di ba meron silang disclaimer at the start na excessive lights can trigger seizure. So this is also the case for some of our epilepsy patients. So in as much as we want to limit their screen time, sometimes they get exposed. So how do we try to protect them from having seizure attacks? So we will have to make sure that we have a well-lighted room for this patient, something that's not too bright. Make sure that they stay away from the screen, so more than about 2 feet. Use a remote control if necessary. What's more important is we limit their screen time. So lately, we've also been seeing what we call these protective glasses that we order from optical shops or online. So there's no harm in using them. There's not a lot of studies though, but it might help, especially for the younger population. Oh, next is video games. So for kids and adults alike, so they have to make sure that they take frequent breaks when they do play. So not long stretches. Diba yung mga adults, maybe 20s or maybe teens, they use it as parang a distressor. And sometimes they forget that gising na pala sila the whole night. They've been up all night trying to play this computer game. So if a patient is a newly diagnosed epileptic and the seizures aren't controlled, we do try to veer away from video games in the beginning. And if ever the seizures get controlled, we still remind them that they should not play in prolonged stretches because we want to make sure that the chances of having a seizure is lower if they don't play. Okay, so we've also come up with the 20-20-20 rule. So I'm sure you're all familiar with this one. So these are for patients who get exposed to the computer screen regularly. So they say that you need to take a 20-second break every hour by looking at something 20 feet away every 20 minutes. But of course, this is not possible, especially for those who work online. So there are patients who say that, Doc, may CCTV na nakatutok sa amin. So, baka isipin kasi na hindi kami nagtatrabaho. So, ideally pa rin, we try to follow this one. Pwede namang magpasimple, di ba? So, kunwari, parang titingin ka lang on your side for a few seconds. But if it's really not plausible, then sometimes we try to advise our patients to at least do it every 45 minutes or every hour. It's better than not doing it at all. And when we say that, it's also important that you warn them that every time you are on break, wag nang mag-cellphone. Kasi di ba minsan we use the break as to catch up on social media or to check our email. So there's a reason why it's called the break, and we want to make sure that we adhere to that one. So again, what we mentioned earlier, the goal is seizure freedom for these patients. And why are we stressing this? Because since you see also our patients, especially in the OPS, sometimes, di ba, they ask you, or kunyari nurse kayo sa pavilion, di ba, the parents or the watchers, they ask you, Doc, or parang nurse, gagaling ba talaga yung anak ko or yung asawa ko, etc., etc. Will he or she be able to live a normal life in the future? So that's always been the goal. And when we get to seizure freedom, then definitely the chances of us going into that direction, meaning a life na, they can get married, they can have kids. In fact, there are also a lot of popular na mga famous personalities na have been diagnosed with epilepsy, and yet, you see them thriving in their respective careers. So that's always been the goal, and hopefully with our help, not just the doctor's help, but everybody, especially in NCMH, we're able to help them attain those goals. So important points to consider when they follow up with a patient or with the medical personnel. So they should have regular checkups. So sometimes when they get discharged from the floors or from the pavilion, diba, we give them a follow-up checkup after a few weeks. And then we ask them to follow up monthly or a little longer, over a month, if the seizures are controlled. And then, as mentioned earlier, you discuss any issues or problems, be it with her personal life. Of course, if the patient allows. But syempre, like, di ba, sometimes they ask advice, o Doc, pwede na ba akong magka-baby? Or pwede ba akong mag-asawa? Can I work? You also discuss about how the seizure meds are treating them, meaning mas inaantok ba ako sa gabi kaya hindi ako nagigising in time for my school the next day, or meron bang ibang physical na side effect or adverse effect yung anti-seizure medication na iniinom ko. And then we also ask for a seizure diary. So basically it's a BP diary, except that instead of just tracking your BP, we track there the time when the last, or the how many seizures happened since the last follow-up, anong date, anong time, anong itsura, gaano katagal. And then we ask them to think about the possible triggers. So, bakit sa tingin mo nag-seizure ka niya? Napagod ka ba? Did you have your menses? So pag females, other than a seizure diary, we also ask them to plot kung kailan ba sila nagkaroon ng menses nila. Kasi sometimes, pwede siyang catamenial na epilepsy. Okay. So, in terms of medication compliance, so it's something that we regularly stress to our patients and to our caregivers, because we want to make sure that a correct dose is administered, and ideally right on schedule. So for kids, since they are still minors, we need the guidance of of their caregivers or their family members. In fact, even those na medyo tumatanda-tanda na, like 40s, 30s, and even the elderly, some still rely on reminders, and that's okay, as long as they're able to take their medications. So some things that may also affect medication compliance: side effects. Pag nag-follow up sa'yo after starting a new anti-seizure medication, sasabihin, Dok, tinigil ko na kasi parang nahilo ako. Yung pala, sunod-sunod na yung seizure. So when that happens, we don't wait for the follow-up schedule. That's why we always tell them, ito yung gamot mo, let's try it out for 30 days. And then, if everything is good, follow up after 1 month. Pero, if may bago kang maramdaman, especially if tingin natin like threatening, like nag-rashes or something, nahirapan huminga, nag-chest pain, we tell them, you text this number, or if urgent talaga, you can go to the emergency room so that we can manage with you adequately. Kasi if you stop the medications, it's fine. Sige, it stops the symptoms from developing, it stops the adverse effects from developing, but we go back to our original problem. It doesn't stop the seizures. So pwede kang magsunod-sunod ulit na seizures, and that's something that we don't want, di ba? As a word of caution, there's a special population here at the bottom. So pregnant patients. So not all anti-seizure medications are good for pregnant women. And this is because it can have an effect in terms of organ development. So notorious dyan is your valproic acid and even your carbamazepine. So again, don't forget to advise them of the things to avoid. So this is actually a good infographics on the right side, because sometimes these patients, they get triggered. Minsan, sorry for my term, pero naririndi sila pag paulit-ulit, lalo na pag naririnig nila from their mom or somebody na close to them. So as your doctor or as your nurse, let's say as your nurse or somebody who sees you regularly at the outpatient clinics, it's good to remind, kasi minsan pag pinaulit-ulit natin siya, di ba? That's the only time that they will actually consider remembering it and doing it. So I just wanted to highlight yung number 4, discontinuation of anti-seizure medications without guidance. So we have to really stress this to our patients, because sometimes sasabihin nila, Dok, 30 days lang po yung ininom ko kasi 30 lang naman yung nasa reseta. So you have to remind that they need to follow up because still need to taper, or we still need to decide if they need to take these anti-seizure medications for a long time and what dose. So one thing that's very much important at this point is knowing seizure first aid. We always say na if something happens, especially since nasa ospital naman tayo, 'di ba, yung setting natin ngayon, we're very confident na alam natin kung ano yung gagawin. But at this point, ang question ko is, are you really confident? Would you really know? So I'm not sure if everybody here has an experience of seeing a patient having a seizure in front of them. But I believe a few weeks ago or last month, we had one in the outpatient clinic. So I'm just gonna show you a video first before we proceed with this one. Or maybe we can just finish this and then let's just play the video after. Okay, so about seizure first aid. So before I end, maybe you can also advise your patient that there are support groups available. So with the advent of social media, actually good din siya, especially for our epilepsy patients and caregivers. Because for our epilepsy patients, they always say na ang daling sabihin, di ba? Na parang, oh, gawin mo to, ganyan, ganyan. Pero hindi kasi natin naiintindihan kung ano talaga yung nararamdaman nila. These patients, especially when they have attacks in school or in the workplace, nahihiya sila, 'di ba? Na parang ano ba 'yan, nag-seizure ako sa school or sa work, and some seizures, 'di ba, they can have urinary incontinence. Naihi ako dun sa pants ko, nakita ng mga classmates ko or nakita ng mga coworkers ko, and it has an effect on them. Ang worry lang namin is the effect might be longer. So we do recommend that, they join these support groups, because once they're able to talk to somebody who is actually going through the same experience as them, lumalakas yung loob nila. Okay? And then if malakas yung loob nila, then they will be more aggressive in taking their medications and doing everything so that their seizures can be controlled in the future. So basically, everything that I talked about in the last few minutes is just a tip of the iceberg. So for us patients na hindi, for us people na hindi diagnosed with epilepsy, ito lang yung akala nating nakikita natin at the top of the screen. So gamot, seizures, tapos pwedeng kumuha ng PWD. But more than that, so if you look at the ones on the bottom, there are quite a number of psychiatric problems also, like anxiety, depression, suicidal ideation, and then even their feelings, diba? So in fact, there are certain conditions in psychiatry like anxiety and depression that can overlap with epilepsy. So perfect talaga yung thrust ng NCMH that we include epilepsy and psychiatry together here in the OPS, because that way we're able to help these patients and we're able to monitor these patients, because it's not just about treating the seizures, it's also treating whatever future complications or illnesses they may have. So if we're able to detect yung signs of depression and anxiety or even suicidal ideations early, then we are good. Okay, so this one I will skip because I will be showing a video later, and there are specific modules that the PLAE actually made for this year that's very much tailored for seizures or epilepsy in the workplace. Okay, so take-home points lang, epilepsy is a disease. There are different types of seizures in epilepsy. It is treatable, and most patients have good seizure control with one anti-seizure medication. Patients can be seizure-free, and PWEs can live normal lives. Okay. So let me just play this video released by the PLAE a couple of years back regarding first aid for seizures. Tapos we'll just discuss some modules after that one. Narinig pa. Rinig. Eto. Ay, nakamute ba ako? Meron? Sorry, just making sure. So I have to remove this. Meron.
Mukhang ina-atake siya ng epilepsy. Ako, ano gagawin natin? Relax lang, Ruby. Tawagin mo si ma'am. Sige. Ina-atake. Sige. Ano nakatagal na si teacher? Ma'am, mga 1 minute na po. Sige, tatagalin natin si Kevin, ha? Ma'am, bumubula bibig niya, ma'am. Lagyan natin ng kutsara. Baka makagat niya yung dila niya. Totoo po ba yun, ma'am? Hindi totoo yun. Hindi dapat tayo maglalagay ng kahit ano sa bibig ng pasyente. Mas mainam na lagyan na lang natin sa pinangulo niya. May mga bimpo ba kayo dyan? O pwede din natin luwagan ng damit niya kapag masikip ito. Tara, ilang minuto na? Ma'am, mga 3 minutes na po. Kapag sumobra ng 5 minuto ang pagsisisure ni Kevin, kailangan na natin tumawag ng ambulansya. Gayon din kapag continuous yung seizure niya at nahihirapan na siyang huminga. Yan, buti na siya. Oh, Kevin, huwag kang magmadali. Paatake mo lang. Higa ka muna. Ipon ka muna ng lakas. Nandito kami para sa'yo, Kevin. Hanggang bumuti ka. Maraming salamat mga bata sa tulong nyo. Sa susunod na mag-seizure si Kevin, kung sino man ang may epilepsy, alam nyo nang gagawin. Para po.
So, let's just repeat it,
Kevin! Mukhang ina-atake siya ng epilepsy. Ako, ano gagawin natin? Relax lang, Ruby. Tawagin mo si ma'am. Sige. Ulit na natin kung gaano siya katagal ina-atake. Sige. Kano nakatagal niya si teacher? Ma'am, mga 1 minute na po. Sige, tatagalin natin si Kevin, ha? Ma'am, bumubula bibig niya, ma'am. Lagyan natin ng kutsara. Baka makagat niya yung dila niya. Totoo po ba yun, ma'am? Hindi totoo yun. Hindi dapat tayo maglalagay ng kahit ano sa bibig ng pasyente. Mas mainam na lagyan na lang natin sa pinangulo niya. May mga bimpo ba kayo dyan? O pwede din natin luwagan ng damit niya kapag masikip ito. Tara, ilang minuto na? Ma'am, mga 3 minutes na po. Kapag sumobra ng 5 minuto ang pagsisisure ni Kevin, kailangan na natin tumawag ng ambulansya. Gayon din kapag continuous yung seizure niya at nahihirapan na siyang huminga. Yan, buti na siya. Oh, Kevin, huwag kang magmadali. Paatake mo lang. Higa ka muna. Ipon ka muna ng lakas. Nandito kami para sa'yo, Kevin. Hanggang bumuti ka. Maraming salamat mga bata sa tulong nyo. Sa susunod na mag-seizure si Kevin, kung sino man ang may epilepsy, alam niyo nang gagawin. Opo, para po.
Okay, so, can you hear me? Okay. Okay, so this primer was actually released by the PLA or the Philippine League Against Epilepsy. So the video earlier was also released by the same institution because we wanted to standardize, diba, on what to do. Nakita niyo yung last sentence doon, diba? Huwag matakot tumulong. Sometimes kasi when we see something that's not familiar, we tend to try to run away. Kaya 'di ba doon lang tayo sa gilid, nagtatago lang tayo. When in fact, we shouldn't do it because yung safety and yung actually yung buhay ng tao, the somebody who's seizing, actually depends on you. So, what do you do when you have a patient who has a seizure? So what they were doing with Kevin earlier, 'di ba? So ang importante is you have to stay calm. You have to make sure that you cushion the head. So, pinahiram nung isang classmate ni Kevin yung jacket niya. Loosen the clothing, turn to the side. And this is because we want to prevent aspiration. And then, most important is time the seizure. So, we need to time it because there's a certain condition called status epilepticus that if it's more than 5 minutes, it can have prolonged or permanent damage to the brain. So basically, ang counterpart lang niya, do not panic, do not restrain. Kasi 'di ba, lalo na doon sa mga provinces, sabi nila kailangan hawakan natin, nagtutonic-clonic seizure na nga siya. So this can actually result into fractures pag tinry mo siyang i-restrain. Tapos yung iba, sinasabi nila kagatin o kaya let's press on the abdomen. So this will also have an effect on the airway and the breathing and the circulation of the patient. Some people, akala nila kailangan mag-CPR or they put an object in the mouth to stop the seizure. So this can actually have further effects, deleterious effects in our patient. So, we have to make sure that the environment is safe. So, tanggalin natin lahat ng pwedeng makasama pa na object. So, if the patient is, let's say, in the kitchen, we have to make sure na malayo siya dun sa range, malayo din siya dun sa fire, malayo siya dun sa mga babasagin na objects or even dito sa mga kutsara tinidor. If the patient is outside, you have to make sure that malayo siya sa mga bato-bato or any heavy objects that can be more harmful to the patient. And then do not put anything in the mouth or move or guide away from harm. So kung kailangan i-move konti, then maybe it might be good. So kung hindi mo kaya mag-isa, then always call for help. So stay with the individual. So after making sure that everybody is safe, you have to make sure that you stay with that patient because we need somebody to time the seizure. Remain cool, calm, and collected. And especially in the United States, they have medical bracelets, di ba? May nakalagay na minsan purple band or even sa iPhone, ay sa Apple Watch, nakalagay epileptic. So may parang alarm sila na ginagamit. You also have to make sure that di ba, minsan maraming nakikiusyoso. Ano nangyayari? Pero hindi naman sila tumutulong. So you have to make sure that the crowd is controlled. So anybody who's there should be somebody who's willing to help out. So ideally, we limit to 2 to 3 people to administer the first aid. So the other people can actually stay behind and try to call for help for like an ambulance. Di ba? Pwede naman sila tawag ng ambulansya. Or if it's a student, they can call the parent or whatever. So we want to make sure that there's not a lot of people with the patient. So the next is you lay the patient to the side. So if they are not, especially if they're not awake and are not aware. So this is to ensure that their airway is clear. So para mas makahinga sila ng maayos, you also have to loosen tight clothes around the neck. So if naka necktie or naka mahigpit na shirt na or zippered jacket, so you have to loosen that one. And you put something small and soft under the head. So we put it because we are assuming that a patient is still in active seizures and sometimes repeated seizures, especially if yung surface mo is hindi naman talaga siya yung malambot na surface, can also produce more trauma to the head. Next is we time the seizures. So we have to document it. Anong oras siya nagsimula, how long siya, and then what time did it end. It's also important to describe what the seizure looks like. So is it generalized tonic-clonic? Is it focal? Is it myoclonic, absence, or atonic? And then you also have to identify, so what was the patient doing pre-ictally and post-ictally. So meaning, pre-ictal is seizure. So kumakain lang ba siya, nagko-computer ba siya, naglalaro lang ba siya sa playground, and after the seizure. So after, so this is where we most commonly see post-ictal changes, ibig sabihin after seizures. Minsan, they present with post-ictal confusion, para silang tulala. Paggising nila, hindi ka nila kilala, hindi nila alam kung nasaan sila. Di ba, tinatanong niyo sila, anong pangalan mo? Sino ka? Ano nangyari? Some patients will also present with post-ictal headache. So, ikaw ba naman, sunod-sunod kang nag-seizure. So, parang sunod-sunod na kuryente yung ulo mo. So, because your brain is hyper-excitable, these patients present with headache. Tapos, yung iba naman, parang post-ictal agitation. Paggising nila after an attack, hindi nila hindi nila kilala kung sino yung people surrounding them. They try to stand up, di ba? Nagpupumiglas, tas parang gusto na nilang makaalis kasi hindi nila alam kung bakit sila surrounded by people like this. So, if you explain to them ng maayos na parang, sir, you just had an attack, I want you to stay calm while waiting for, let's say, an ambulance, samahan nyo sila and reassure them, then these patients after a few minutes hopefully will go back to their normal. So this is what we do in terms of recovery. So reassure and provide comfort, talk gently to comfort and reassure, and stay with them until they are reoriented. So after a seizure, we also need to examine them. We have to check if there are any injuries. We have to make sure that if they have any family members that need to be informed, we call them. If there's a need to change clothing, nadumihan ba siya, nung inatake siya, or naihi ba siya dun sa salawal niya, then we need to do it. Then you ask the patient to rest. Don't make them eat or drink first until they're fully awake because there's a higher risk of aspiration, and have someone remain with them until they're fully recovered. So we need to call our emergency hotline if the seizure lasts longer than 5 minutes or the person does not return to their usual state, if the person is injured, pregnant, or sick, if the person has had repeated seizures, if it's a first-time seizure and they do not know what's going on, if the patient has difficulty of breathing, or if the seizure occurs in water. So very self-explanatory kasi very high risk to aspirate, di ba? So, more than calling, kasi minsan, di ba, nasa Philippine setting tayo, wala masyadong matawagan. Usually at this point, we call for help and then help will come. Tapos may ambulance or there might be somebody who can drive that particular patient to the hospital so that the patient can be evaluated better. So again, do not panic, do not restrain, do not put any object in their mouth. So be it a spoon, a fork, or a thumb depressor. Do not restrict movements and do not blow on the mouth because we want them to breathe. Diba? So a seizure can strike anywhere at any time. And then if we follow these simple steps to maintain an individual safety, then we are sure that we will not cause any more harm in our patient. So I think this is also the same video that we showed you earlier. So I just wanted to add two more short modules since we're talking about epilepsy in the workplace. So like I said, NCMH, everybody here who's listening, we're very lucky because medical tong institution na to, 'di ba? But what if let's say you have a relative or you know of somebody who doesn't work in the medical setting. Ibig sabihin, pwede nagtatrabaho sa call center or anybody there na walang direct access to medical management. So what are the factors to be considered when looking for safety? So you check for the type of the job, the risks in the environment, the work hours, the availability of a seizure first aid kit, employer and behavior attitudes and employer and employee attitudes and behavior, and the need for disclosures about seizure. So some things that you have to avoid in terms of making sure that these patients are safe in the workplace. So again, if you look at the top part, diba, it's really reminding them that skipping anti-seizure medications is the most common cause of your breakthrough seizures. So when it comes to recruiting someone with epilepsy, this is the greatest fear of our epilepsy patients. Doc, I don't want to disclose to my future employer that I'm a diagnosed case of epilepsy kasi natatakot sila na baka hindi sila i-hire. When in fact, pwede naman silang magtrabaho. So there's actually a rule that you cannot discriminate against these types of patients. So most people with epilepsy will have the same skills and abilities as those who don't have the condition. So prospective candidates for jobs are not obliged to tell an employer that they have epilepsy before a job offer is made. So most employers ask new employees to complete a medical questionnaire after a job offer to ascertain whether any reasonable adjustments may be required. So for our particular patients, when we make their medical certificate, di ba, we usually issue a fit to work clearance. And in the clearance part, that's when these employers find out that they have epilepsy. Now, if this patient seizures has been controlled, nilalagay naman namin doon sa certificate na neurowise, fit to work. Last attack was, this particular date, advised to avoid seizure triggers. And known seizure triggers would include something that's more for the patient. Ibig sabihin, yung behavior niya in terms of how he manages his epilepsy. Do I take my meds regularly? Do I avoid the trigger, etc., etc.? So accessing professional advice by occupational health or an individual's physician is essential for an employer to show they are supporting employees appropriately. So if the treatment is optimized, which can take time to achieve, most people with epilepsy can remain seizure-free. Okay, so generalized safety tips: use the elevator instead of the stairs. Only climb to heights that would not cause injury if a seizure occurred. If seizures are not controlled, talk to your doctor or nurse about how seizures should be handled at work. And you need to develop a plan for seizure first aid with your employer and involve relevant co-workers who may be present when seizures occur. So make sure that this plan includes when to call for an emergency. So it is rational to be concerned about working in environments where seizures could have some serious consequences for everyone. Individual risk assessment is very important, particularly those working with machinery. Anyone who works at heights, drives, operates motorized equipment or machinery, works with fires, metals, furnaces, deep water, or with prolonged periods alone will need individual risk assessment and support. So some work environments pose many possible hazards for people with epilepsy, while others may not be suitable for someone with seizures. Creating a safe work environment for people with uncontrolled seizures requires co-workers and employees to be adaptable to the safety adjustments needed. So epilepsy-friendly employers and co-workers do exist, and individuals whose seizures are controlled on anti-seizure medication may have no need for special accommodations at all.